Hi, I'm Jen Lee, Head of Marketing for The Bump. Thank you for joining us for this installment of Reclaiming Your Power. Reclaiming Your Power is our series devoted to highlighting changemakers who advocate for better outcomes for Black mothers in the fight against the maternal mortality crisis. It is such an honor to introduce you to Dr. Kendra Segura. Dr. Kendra is the OB-GYN next door, but she also wears many hats. She's also an author, an entrepreneur, a motivational speaker, and she's a wife and a mother. Dr. Kendra, thank you so much for joining us.
Hello, everybody. Hello to The Bump. I am so honored and I feel privileged to be on this platform that serves so many women. I myself am a community member of The Bump. And so I want to add and amplify The Bump. And many of you know me, Dr. Kendra from Married to Medicine Los Angeles. Many of you know me, Dr. Kendra, the OB-GYN next door. And I just want to say that I am here to yell to the top of my lungs that I am just honored, and I love what you guys are doing. And any way that I can be a part of it and help the cause, I'm here. So thank you for having me.
Dr. Kendra, I was introduced to you through the Bravo show, Married to Medicine LA. How has that platform impacted your ability to really show up as a medical professional?
And it's definitely impacted in a positive way because it's helped me build trust quicker in my patient encounters because patients feel like they already know me. They already know my why. And I think it's important when you have a relationship, any type of relationship, and especially in something as delicate as OB-GYN. We deal with people in their milestones, their moments where they'll never forget. And when they feel that they know why you do what you do, when they feel that you care, or they know that you live in the community that you serve, they somehow trust you quicker. And so it has positively impacted how I treat patients as far as management, because they come in already knowing me, introducing themselves, telling me how they relate to me. And what I find is that they are able to kind of listen, and I'm better able to guide them. And it takes less patient encounters, less time for us to get to serving their health. That's what I'm there for. I'm there to optimize women's health, GYN health, OB health. And so definitely Married to Medicine has given me a platform where patients just come in trusting me. They have a baseline of trust.
That's great. And I couldn't agree more. Trust is one of the most important factors when you're going through a process like that. So thank you so much for sharing. So Kendra, the other great thing about what you do every day is that you've brought your leadership as an OB-GYN and a master's of public health to a community clinic in Los Angeles. Will you share a little bit more about the purpose of a community clinic and how it can play a role in improving maternal health?
Community clinics, it's very important because it's what it says. It's healthcare in the community. And it's oftentimes right down the street from a person who really needs help versus them taking the bus to go far away to big healthcare systems. And it's so important for us to actually expand our community healthcare, because what we're trying to do is raise the standard of care in communities, because a lot of my patients don't have cars. A lot of them are on public transportation. And so being at a place that serves the community means that it doesn't matter if you have insurance. It doesn't matter what type of insurance. We're here to offer you services. And so another thing that being on Married to Medicine helped with is that people knew that I was right down the street. Those people who were in Los Angeles, they knew where I worked, and they didn't realize, a lot of them didn't realize that they had a health center right down the street from their house. And so I think that bringing awareness to bridging the gap for Black maternal fetal medicine, it allows us to increase our funding. And when we can increase our funding, we can increase the standard of care. We can access more things for women. For instance, what I'm helping create at my clinic is an outpatient surgery center. And we don't really find that with people who don't have insurance or who are on Medicare or Medi-Cal. It's usually people with better insurance that can go to outpatient surgery centers. So I'm bringing my skills as far as my public health degree, knowing and understanding the patient population, because we can create opportunities all day. But if we're not addressing the social determinants of health, if you're not giving people resources to actually get to the opportunity, to get to the result, then we're constantly having a gap between the quality of care. And so my mission to bring to the community is not only equality, but it's equity. And those two things are different. Equality is bringing resources and opportunity, and equity is bridging that gap, saying that, you know what, how can we get this woman to her appointment? How can we help her with childcare so she can come to her appointment? So it's also giving people the resources to have the same outcome that we're looking for.
Thank you, Dr. Kendra. Your point about equity is one that we need to give more attention to. So just in closing, do you have any words of encouragement for Black women who may be thinking about expanding their families or who may already be pregnant?
I tell my patients, my friends, that if you're planning a pregnancy or you're already pregnant, I want you to put together your team, your village of support, because success in anything, you don't do it alone. So if you're not pregnant and you are going to be pregnant, find a support system. A lot of women, unfortunately, don't have spouses. For me, my support system included my spouse, who was my advocate, and who actually, Hobart, was actually my postpartum doula, if you will. Okay, he is the reason why I was successful in breastfeeding 14 months for my son, Hart. And so when just like when you're getting ready to get married, you line up your bridesmaids, you ask people, can you go on this journey with me? The same thing with pregnancy. You want to identify people in your tribe, your village, because you can't do this alone. And you want to have them there because it's hard to advocate for yourself when you're in pain. It's hard to advocate for yourself when you're sick. And simply when you're pregnant, we go through ups and downs, and we just don't have the energy to say, hey, I have this pain here. So it's important to have other people to speak for you, to ask the questions for you when you cannot. So I really tell people to get a team, and I'm a part of that team. Your doctor is a part of your village that has your back. And that takes work on your part. So the beginning part, before you even get pregnant, find a doctor you connect with. Find a doctor that you're comfortable with. And many of us, maybe it's hard to, but that's why you have, a family member, a good friend that you trust to help you advocate for yourself. Because if we don't, speak up, how can we say that our voices are not being heard? We're not asking questions. We're not speaking up. We're not telling people over and over and over again. And unfortunately, in some cases, we are. So again, it's no simple fix, because we do have implicit bias, and that's the light is being shined in healthcare. And through the media, through everyone being aware of these alarming numbers of disparity amongst Black mothers and white mothers and all other races, quite frankly, is that now we're training healthcare professionals to check in with themselves. And even myself, even being a woman of color, I have to do weekly check-ins, daily check-ins sometimes, especially when I'm entering that zone of fatigue. Okay, healthcare professionals, because of the pandemic, a lot of us are still dealing with our own personal fatigue. So we all have to play a part. Is that the complete answer? No, but definitely this is too important. Being pregnant, healthcare in general, especially for us Black mothers, it's imperative for us to have a village and have voices to speak when we can.
Dr. Kendra, thank you so much for doing your part to help save lives and keep our communities healthy. It has been such a pleasure talking to you.
Again, thank you for having me. I'm Dr. Kendra. You guys can reach me on IG at Dr. Kendra MD. You guys can come and see me at To Help Everyone Health and Wellness, right in the heart of Los Angeles. Just Google it, make an appointment, and I look forward to seeing you or answering your questions on social media.
For more info, visit the Bump Black Maternal Health Hub so you can be supported, informed, and empowered during your journey to and through parenthood.